It's been 1 week since a 24-year-old man went on a shooting rampage inside a Colorado movie theater. A dozen people were killed, nearly 60 more were injured in one of the worst mass shootings in U.S. history. The suspected shooter, James Holmes, was, until this June, a graduate student at the University of Colorado in a highly demanding neuroscience program. You know, what a lot of people have been talking about, been asking me is, do you know what was happening inside his brain, in his mind? And also, if a colleague or a family member were ever going to possibly pose a danger, would you know it? What would you do about it? Clinical psychologist Xavier Amador is the author of I Am Not Sick, I Don't Need Help, How to Help Someone with Mental Illness Accept Treatment. Thanks for joining us, sir. I really appreciate your time.
I'm glad to be here.
I do want to talk about, what some of the warning signs might be in family members or colleagues. But first, there's a lot of mystery surrounding James Holmes still. James Holmes, the University of Colorado said very little. All we know is that he left his neuroscience program in June. He did badly on an oral exam, apparently, but was not forced out of school. The school has told the students and faculty not to talk with reporters, which, is understandable. But a lot of people have asked, could this have been predicted in any way? Can this sort of thing have happened essentially in a very short time or even overnight? What do you think about that?
Very unlikely overnight. If this was a drug-induced, for example, psychotic episode where somebody gets violent after using PCP, cocaine, sure, we see that. But that's obviously not the case here. Just from even the great distance where you and I sit, that's clearly not the case. There's no drug use reported. But, I think people are asking those questions because the story is starting to sound all too familiar. Here's somebody who was functioning really well, Sanjay. He was doing well in school. He was socially engaged. And then suddenly it's as if something snapped and something suddenly happened. In fact, it probably was an insidious and slow descent into psychosis, if that's what's going on in this case.
Part of the reason I think people are interested is because based on that, since it is a slower descent, as you say, it seems like there's places where intervention could take place and warning signs may have been noticed. And again, no one's casting blame here on anybody or anyone, but I mean, are there specific warning signs that you tell people to be concerned about?
Yeah, absolutely. But let me emphasize something that you're touching on that I think is so vitally important. The first treatment that people get when they develop schizophrenia, bipolar disorder, other serious chronic psychotic illnesses, if that's what we're talking about here, typically it's 7 years after the onset of the first symptoms. The duration of first treatment, according to the NIMH studies on this, 7 years. So we've got a lot of time to identify the warning signs. And the warning signs are things like we're hearing about in the case of Mr. Holmes. Sudden change in functioning, withdrawal, becoming isolated. Sometimes that can be confused for depression. The easiest way to find out is to engage the person, talk to them, ask them about the change in their behavior. You're spending a lot of time alone. How are you feeling? Are you feeling sad or blue?
And it's interesting because I think that particular issue, I think, has had a lot of people wondering this week. Many people with mental illness may not recognize that they themselves have it, and they also refuse offers of help. I mean, how hard should an average person push? Let's say it's a family member, for example. What is someone to do?
Well, I'll speak first personally as a family member. I had a brother, my brother Henry, who had schizophrenia, and his illness emerged very, very slowly. I was 21, he was 28. He had actually been ill since about the age of 24. And I thought his problem was he was lazy, he was giving up on life, he was immature. In fact, he was exhibiting what are called the common negative symptoms of schizophrenia. For example, when I looked at Mr. Holmes at his arraignment, I saw a lot of what we would call flat affect, where he doesn't express much emotion. A lot of people were wondering about medication. My first thought was, are we seeing a negative symptom of schizophrenia? They recognize the way they sound, and they know that other people just won't understand that they have a special role in the world, they have special powers, they're Batman's nemesis. I have no idea if that's what went through Mr. Holmes' mind in this case.
That's really
That's the kind of thing that's really common.
I mean, that they have the self-awareness to recognize, you're suggesting, how they might sound.
Right.
Is there a pitfall? I mean, people are scared to talk to folks who they think potentially might be dangerous, or maybe they just don't take the time. Is there a pitfall to avoid when talking to someone that you're concerned about?
Yes, don't give your opinion. And that's the biggest mistake people make, is we give our opinion. When somebody says things like, I don't really want to talk about this, but I think the CIA has got us under surveillance. You know, my eyes and other people's eyes get wide, at least what I used to do, and we try to reassure the person. Instead, pardon the expression, but I learned, frankly, to shut up and listen. You don't have to agree with the person. You shouldn't lie and agree with the person. Just don't jump to looking incredulous or doubtful or judging what they're telling you. And what you'll find is they'll open up. And it's really vitally important that people who are experiencing these psychotic symptoms have someone they can open up to. Otherwise, they're alone with their delusions. If they're hearing voices, they're alone with their hallucinations. And whatever those hallucinations and delusions are telling them reality is and what they should do.
You know, people don't think about it as concretely, I think, as you've just put it. So I think it's, again, a very important message to hear. I hope to have you back. These are tough topics to talk about, but I think important. A lot of families hopefully listening to you today. Xavier Amador, thanks so much.
Thank you.